Yeah, so my name is Sara and I had surgery at the CGIC in 2021 in the summer, but I've had issues going back way further. I think probably in my early 20s. I'm 39 now. I always had somewhat painful periods, but then they got more and more and more painful. And that was my main symptom for a long time. So for me, it was kind of a process of trying painkillers and trying everything and being told, that's normal, just deal with it, and going into doctors and being told, we can put you on birth control or whatever, but no real understanding from anyone that I talked to that this is a real problem, that it should be diagnosed and treated, not just covered up. I think my story with that is pretty typical. I started asking specifically, isn't there anything I can do to find out if this is something serious? It feels like it's something serious, and being told, no, we don't really do that. So finally, I did a bunch of research and was like, look, I want a transvaginal ultrasound, please. And it took, I think, 6-7 years of complaining to doctors before they actually did that. And when they did, they said, oh yeah, you do have fibroids. They found 3 smaller fibroids, and they were like, fibroids usually don't cause too much pain. They're small, so that's probably not worth going further with. And nobody really suggested endometriosis to me either. But in retrospect, they did find endometriosis on my surgery. So I really started advocating for myself at that time, because I was like, this is too painful. It's too debilitating. I was, just having pretty crippling pain, like a quarter of the time, and taking kind of higher doses of NSAID painkillers, like Aleve was my standby, and just taking that at a much higher dose and more frequency than is recommended. Yeah, so I finally was able to get more imaging done and confirm that actually there's more fibroids, and they hadn't seen them all originally. But it took me another lot of years to be able to get insurance that would cover a procedure like this. So I think pretty soon after I got that first diagnosis, I started researching online and found you guys. And you have a great, really informative website. I really appreciated that. But I didn't have insurance through my employer. I was an independent contractor, self-employed. So it took me another bunch of years to be able to figure out how to pay for it. So I think that, I was looking for something that would help, treatment. Like I have never responded well to hormones. They've, caused more problems than they've fixed whenever I've tried them. And I just don't like the idea either of, this is a symptom that you have when you're on your period, and so we're just gonna hide your period, and then it may actually be getting worse, but you won't know because you're just not having a period. So I definitely, had some fears about surgery, but the more I researched, the more I was like, this just seems like something that shouldn't be there, and it needs to be removed, or it'll get worse and maybe cause other damage along the way. I think what I was really looking for was something that was minimally invasive. Is there a way to do this that isn't, is there a way to do this surgery that's not going to be super invasive, that's not going to, fillet me open, end to end, and leave a bunch of scars and do more damage than it's going to cure. I definitely got a couple of different consults. I'm in Oregon, and I ended up getting my surgery in New Jersey. So I looked at local options as well, and it just seemed like the standard procedures for fibroids are either laparoscopic with a bunch of incisions and high odds of that they wouldn't get it all, or that they would miss something and thought that they had gotten it all. And for small fibroids, it sounds like that actually requires a bit more skill. And so when I found the CIGC and read the website and had my consult, what really appealed to me about that approach was that it's less incisions, these incisions big enough to put a finger through, so they could actually feel around and make sure that the tissue that's being left behind is smooth and not lumpy. So just from that approach of being able to have a surgeon physically who's a specialist that can get in there and really make sure they're doing a good job and and get it all was what really convinced me that I wanted to go to you guys and not somebody else. It was a lot to plan. My sister lives in New York City, and so I scheduled a trip to come visit her, and then she was able to drive me there, wait, and it was actually really fast. I think we went first thing in the morning and we were back home by midday. So that part worked out really well. I definitely am glad that you all insist that people have a person, because I was, not okay that day to have, taken an Uber or something like that. But yeah, I went in, got set up, and then came to a couple hours later and felt fine, more or less. I talked really briefly with the doctor after, and he said we did find endometriosis as well and removed that. And then I went home. I actually didn't make it all the way home. I got super nauseous as soon as we started driving, like horrifically super nauseous, and ended up vomiting a lot for the next couple of days, which I guess is a side effect of anesthesia that's common in young people. So I had joined a Facebook group that, like a support group for fibroids and endometriosis, and they had all told me, bring a pillow, because you're going to want to have something to put over your abdomen to hold there in the car, or hold there if you need to like cough or if you need to vomit or anything like that, just to have that support. And so that was, I think, the single most helpful piece of advice that anyone gave me. But once the nausea subsided, the recovery was really quick. I didn't actually have serious pain. I didn't have to take most of the pain medications. I was able to pretty quickly go back to Aleve and like over-the-counter stuff. And then I was able to walk around and take care of myself by the next day or two. So long story short, I'm like extremely grateful that I figured out how to do it and was able to do it, and that I got the surgery, that I got the endometriosis removed, that I got the fibroids removed. I do think it made a huge difference. I wish that my story since then had been simpler, but I ended up, they recommended that I get an IUD after, and I said, well, I want to let my uterus heal a bit before I introduce another thing. So a couple months later, I got an IUD, and that ended up being really bad. It felt like it was stabbing me. And then it kind of settled, but I was having a lot of cramping and negative symptoms. And everyone I talked to was like, you really should have some sort of hormonal birth control still, even post-surgery. And finally, I decided to ignore them all and got off all the hormones, got the IUD out, and felt way better ever since. So that's kind of my story. Is I know, kind of covering up symptoms with hormones is the standard procedure, but I recommend that people who don't want to do that, or if that's not working for you, it was really great for me to be able to remove it and have just a baseline of what is my body doing. And for me, my periods have gotten a lot lighter. My pain is more like how it was when I was a teenager. So, no pain, but totally within normal. I can take like one Aleve and I'm fine. For anyone who's just beginning going down this road, I would strongly recommend that you advocate for yourself. If your symptoms are debilitating, don't take no for an answer. If people say, oh, let's wait and see, either educate that doctor or get a different doctor. My experience is that they have no idea what they're talking about, pretty much all of them. And they've been taught that, this kind of pain is normal and that maybe it'll resolve, or if they don't know what to do, the best course of action is nothing. And so fibroids, can be really painful, and you can diagnose them from a transvaginal ultrasound. So absolutely do that. But process of elimination is the best you've got really as a patient with menstrual pain or reproductive area pain. And so if you've ruled out fibroids, if you've ruled out ovarian cysts, if you've ruled out, sciatica or whatever, then it probably is endometriosis, and you probably do need a laparoscopic, surgery to get in there and confirm. And if you're having the symptoms, you probably have it, especially if you've ruled out everything else. I love that you all are out there advocating for less invasive and really smart surgical approaches. I think that that's desperately needed. And I hope that what you do is adopted by more different practices around the country and becomes more standard, because it seems weird to me that an approach that works really well would be, only really available from one provider. About the scar. The scar was one of the things that I was really worried about, and I just got 2 incisions. It's one on the bikini line, one through the belly button, and the belly button scar was pretty much invisible like within a week. The bikini line scar was like a centimeter long, or it was shorter than they said it would be, and healed to almost invisible. So you really can barely see it now. So I think that's incredible that I got this kind of relief with almost no scarring. And it definitely felt like the only real, damage from the surgery itself was like as tiny as humanly possible to get in there. And then they did obviously a lot. They found 7 fibroids. So I could feel it in my uterus for the recovery, but in terms of the incision sites and, getting there, that was pretty much 0.